Getting adjusted after a workout, or if you're sore and you get adjusted, it can really help out with soreness. It can really help out with the stiffness associated with the workout. Hey everyone, this is Dr. Warren Kalkstein, and I'm going to introduce Shikanda today. Shikanda has been working with me over the last few weeks, and we just started more of a full body rehab strength program with her. But I'm going to let Shikanda talk a little bit about her history with her complaints coming in to see us, and the areas where she was really hurting in the past, as well as more recently a little bit more focused on that hip. And yeah, Shikanda, go ahead and tell everyone what brought you in the first place.
Originally I started coming in due to a previous injury that I sustained while on active duty. And it was mostly just my left hip, which kind of went into some lower back pain, but not too much. So it's mostly kind of focused in the left hip region, kind of in the glutes. Yeah. So when I started coming in, it was mostly just a lot of tightness, really just really hard for me to run, to really put a lot of pressure on that area. So we started with the needling, acupuncture. So kind of so we started there. Physical therapy, it's tough, but
you just started the FSP program.
It definitely helps. I know when I go home, I can kind of feel just areas that have really been targeted and hit, things that I haven't really thought about, but after moving around and getting home and doing my own stretching, I can feel specifically what areas have been targeted, and honestly those are the areas that have been giving me trouble. So
yeah, that's where you need to do it.
Yeah, so focused on my problem areas, so I can definitely feel a significant difference. Mostly feeling a lot stronger in those areas. So just I don't know, it feels really good. I enjoy coming back. This is the second or third time that I've been back, but every time that I come back, I find something new to take away. Just adding tools to my toolbox to be able to do things at home to, just keep on the straight and narrow and making sure I don't keep re-injuring myself.
Yes, right on. That is exactly what it's about right there. So in so many ways, she just explained to me what a good experience should be when it comes to managing a complaint that's been a long time, right? You've had this area, this discomfort for a long time. So what just happened? She's getting a great experience, but she has, I think that too much focus is put on me in a lot of these videos. You don't get to see the one-on-one interaction from Mo and Patrick. They do an amazing job with the rehab program,
awesome.
and making working out a lot of fun. So I highly recommend them all the time. I speak highly of them, probably not enough to them directly, but definitely to people that get to watch our videos, as well as to our patients. We have that conversation on a regular basis.
Yeah, they're awesome.
They're great.
Yeah.
And then, so what did she say? She's getting challenged in areas that she's weak. She's having a good experience doing it, and she's learning new ways of lifting and being active. So that's from a patient experience, that's really important. From our clinical eyes, if you will, the program is designed around those weaknesses. It's designed to challenge her in an escalated way. It's designed to allow you to have enough rest. That's not talked about a lot, but enough rest between visits so that you can actually continue to get stronger, and we're not making you sore just for the sake of being sore. Right? And then we couple that with focused manual therapy in the form of chiropractic care, and treating the areas where you're tense and you holding, if you will, a lot of tension, discomfort in the joints and the muscles of your body.
Yes.
Okay, I hope that explains what a good movement and strength rehab program should be. And if you're not getting that wherever you're going, keep looking, because there's people out there that are with it and doing that for people, and it's awesome.
Yes, it is.
And Shikanda's awesome, and she deserves that. So let's go ahead and come on up for me. Let's go ahead and start and face down. Let me get the face paper down here for you. Shikanda, this is a wild week. What are you gonna do to take away your mind from all the stuff going on and maybe have some fun?
I'm hanging out with girlfriends.
Nice.
Yeah, we're gonna have a little watch party tonight and just kind of pig out, have some drinks.
Good for you.
Yeah, just practicing self-care, honestly.
Heck yeah. Do it. I love it. So my wife is a mental health therapist.
Awesome.
So she's big on self-care and mindfulness around that too. And I've learned a lot from her in the 2 years that she's been a therapist, and even prior to that, about different ways of being mindful and being practical, about incorporating that into life. It's not all about work. It can feel that way sometimes, but we gotta make time and effort towards the other side of things.
Yep, balance.
Take a deep breath in and exhale easy. Good. Relax your shoulders. Good. Right here, let it fall. Good. I'm going to relax your hip a little bit here, and I'm going to do a little soft tissue work on this glute, okay? You're going to feel pressure right on the outer edge of your hip here. And then I'm just going to relax your leg, open, 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 open. Good. Again, bring it across. Let the foot relax. I got you. Right there. So this is just an easy, gentle bend and stretch technique for the glute med and the piriformis. I'm loading my body into my elbow right now, putting a lot of pressure downward and holding that muscle underneath my arm, and then I'm waiting for her to relax so I can stretch it out, and I roll over it with a little bit of cross friction. And I do the reverse for the glute med. Relax. Pressure right here, just gonna loose. Good. And send a little more rotation. Okay, here and here, a little tighter. Good. So this might not get talked about, and from a manual therapy standpoint, a lot, or it might not be as much of a public knowledge, if you will. But getting adjusted after a workout, or being, if you're sore and you get adjusted, it can really help out with soreness. Can really help out with the stiffness associated with the workout. And then doing it afterwards, that makes you less likely to really feel a lot of that significant soreness. It's a nice addition to what we do with you. Come on to your side for me. You feel that way?
Yeah.
Nice. Did you get exposed to chiropractic in the military?
Yeah, actually I did. Yeah, that was the first place that I'd ever,
Was it at the base that you told me you had to work at a little bit?
Yeah.
Usually they've got somebody on base. The hospitals, the VA system is a little bit...
It's a little bit different, yeah.
It's different for sure.
Yeah, they have to outsource because they don't have like the... Yeah, it's actually
people
a program.
on staff.
Yeah, they don't have the people on staff, so it's more... I think it's called community-based, like outsourcing or something like that.
A lot of services that they don't have within the hospital setting that they have to do that with. Some VAs, if they're large enough, or if they just got somebody that worked their way into the system, have a chiropractor on staff.
Yeah.
But I don't think the Baltimore...
It's not. They don't.
Take a deep breath in. Easy exhale, loose. So just relax here and here. I'm going to pull you underneath me. You're going to feel pressure right over your sacrum there. Good, and loose. Perfect. Awesome. Come on your back. So I'm going to do a little long axis traction on her hip. When I do this, she'll feel a little movement in the joint of the hip. It's a really nice, comfortable adjustment to get mobility to the joint, and very effective. relax. And if I feel tension, like, you know, she's getting her leg pulled on, so a natural response is for your body just to say, well, hold up, what's happening? So if I feel that tension, what I'll have her do is just relax. External, internal rotation will relax her a little bit, and I'll take traction into the joint. If I feel like it's at lockout, I'll adjust. If I still feel like she needs some movement, you should kind of go ahead and hike your right hip up, and more so towards your shoulder, not the ceiling. You got it, just like that. Basically resisting my pressure. Now relax, a little bit more traction, and adjust. Good? Wonderful. Good to see you. Have fun with your ladies tonight.
Thank you.
Yeah, you deserve that fun. Thank you for your service. I really appreciate you.
Thank you for your support. We appreciate you.
Definitely, absolutely. Support them all day.
One time next week, or?
Yeah, just once next week.
Awesome.
For